All right. Well, nearly half of Americans are considered to have high blood pressure. That's the big headline this week, following new blood pressure guidelines issued by the American Heart Association.
Okay, so why did they change the guidelines, and should you be concerned? Those are good questions. And our medical reporter, Rosemarie Beltz, actually talked with some experts. She has more on what you need to know.
The nation's leading heart experts are raising awareness of the life-altering consequences of uncontrolled high blood pressure and to motivate people to talk with their doctor and recommit to a treatment plan. I spoke with Dr. Abe DeAnda, professor and chief of cardiovascular surgery at the University of Texas Galveston Medical Center, to learn more about what prompted these new guidelines. Even though doctors have been able to reduce negative outcomes, cardiovascular disease remains the leading cause of death among Americans. These new guidelines have been put into place to reduce the impact of heart disease, hypertension, and stroke in our country. Since we cannot change our genetics, the American Heart Association is honing down on the modifiable risk factors associated with heart disease, and high blood pressure is one of them. Hypertension, known as high blood pressure, will now be defined as 130/80 for anyone with a significant risk of heart attack or stroke. The previous guidelines defined high blood pressure as 140/90. Your systolic pressure is the top number and represents the forward-moving blood from your heart to your body. The bottom number represents the pressure when your heart is resting and filling with blood. If the bottom number is too high, you can damage your heart and coronary arteries. I've heard some criticism of the new guidelines, saying it only promotes expensive high blood pressure medication. But doctors say the first best option is still diet and lifestyle changes. The holidays can be a bad time of year for health. Doctors recommend taking all things, including stress, in moderation. After you have a big meal, it's not a bad idea to get out of the kitchen and go for a walk before you plop down to watch a football game. Rose Beltz, Creme 2 News.
Probably some good advice.
Very good advice. I think we could all use a little bit more of that.
Yes, indeed.
All right.